Hi, my name is Jackie and we're going to be doing Foley catheter insertion and removal today. I will make sure that my patient was assessed and cleaned prior to catheter insertion, and we're ready to get started. Hi, my name is Jackie and I'm going to be your student nurse today. And can you go ahead and verify your full name and date of birth for me? Okay, thank you. And do you have any known allergies to things like shellfish, latex products, or iodine products? Okay, great. We're ready to get started. Going to go ahead and provide privacy and wash my hands. And today we're going to be, the doctor wanted me to insert a catheter tube, and so we're going to get a sterile urine specimen for you. If this was a bed, I would raise the head of the bed and lower my side rails. Okay. Going to go ahead and position the patient, position the legs. Okay, yeah. Lift up for me. And put this right here because I don't want to reach over my sterile film. I'm going to go ahead and open up my lube. Going to go ahead and put the tip in the loop. My patient. Okay, this is going to be really cold, okay? I'm ready to spread it. Okay. Side farthest. One swipe down. Trash. Side closest to me. One swipe down. Throw in the trash. This is the most important part. One swipe down the middle. Throw it away. It was already placed in the lube. Ready to insert, okay? Just probably relax as much as possible for me, okay? I would go into I see urine return, and then I would proceed in another 1 inch. Okay. I don't want to try to have too many tangles. Okay. We're ready to insert 10 cc's. Now we'll throw this in the trash. Make sure, hold on, I'm sorry. I was supposed to check to see if it was anchored in before I took my gloves off. I'm gonna hang it on the side and ready to tape it to the leg. Now I'm ready to put on some clean gloves. specimen. Okay. Get an alcohol swab before I put it back in. Okay, now I'm ready to clean the patient's perineal area. I would do the four corner technique. Okay, I'm ready to cover my patient. Is everything all right? Ready to position them back to a comfortable position. Cover them up. And I'm ready to throw away my supplies. I'm going to remove this because I got to use it for the removal. And all this stuff will be in the trash. This will go in my red bag. Got my urine specimen. Okay. Ready to get rid of my gloves. Okay. Now I'm ready to raise the head of my bed. I mean, lower the bed. Put the patient in a comfortable position. Put the call light in reach. And that's it. Now I'm ready to wash my hand. I'm going to go ahead and I already got rid of my supplies, got my urine specimen. Now I'm ready to document in the EHR. So in the EHR, I would document my patient's tolerance, the color, the consistency, and the amount of urine that was obtained, the number of attempts, the date, the time, the fact that it was taped to the leg and hanging with gravity, the number of cc's injected, the fact that it was a sterile procedure. That's it for that part. Okay, and I think that's it. Okay, so now I'm ready to go ahead and remove the Foley catheter. And so I will go ahead and gather my supplies. Like I said, all this wouldn't be here, but now I'm ready to go ahead. I'll take a couple of gloves in. Take some cleaning supplies in. Picking up a drape. And got a bag, red bag. And I also would take in a basin or some type of container where I can get the urine that has to drain out, depending on the policies, the hospital's procedure. But I'm just going to use this for pretending. Okay, so I think that will be it. Okay, I'm ready to get started. Hi, my name is Jackie. I'm going to be your student nurse today. Can you verify your full name and date of birth for me? Okay, great. How are you doing today? All right, we're going to go ahead and we're going to remove your catheter today. So I would go ahead and actually, provide privacy, and I would go ahead and wash my hands, and I would go ahead and put on gloves and go ahead and drain out the drain out the bag. That'll keep it from being such a hassle later on. Drain it out. Close it. And this would go in the toilet, trash can, whatever the policy is. I guess you could clean this again, and then you're ready to go ahead. Uncover my patient. Go ahead and you remove the tape. Put my drape up under my patient. Can you hold up for me? Okay, we're going to try to make this as quick as possible for you, okay? Ready to go ahead and uncover my patient. Get my tissue. Oh, where did I put that? Okay, gotta get the syringe to deflate it. Cover my patient back up. Okay, yeah, I'm ready to go ahead and deflate the balloon. I could actually leave that on. And now I'm going to go ahead and uncover my patient, position the legs to my fitting, and then I'm ready to go ahead and remove it. Okay. Okay, just relax for me. I'm going to do this as quick as possible, okay? Ready? Making sure not to splatter anything. Okay. I'm ready to go ahead and put this in the right bag. And now I am ready to go ahead and clean the patient. And this isn't the way I would do it, but we're running low on supplies, so I'm just gonna pretend. Okay, you alright? Alright. Go ahead and do that. Cover my patient up. I'm gonna go ahead and get rid of my supplies. I'm ready to go ahead and position my patient, lower my bed again, put my side rails back up, put the call light back in reach, make sure my patient's okay and comfortable, and then I'm going to wash my hands. Yeah. Okay, so now I'm ready to go ahead and document in the EHR again. And I'm going to document the fact that it was removed, that it was intact, the color, consistency, and the amount of the urine, the fact that 10 cc's were removed, the patient's tolerance, All right.